So I'm a board certified psychiatrist and I've helped over 160 PMHNPs gain clinical confidence in their psychiatric diagnosis skills, their treatment skills, and being able to get patients better results. So that way they are satisfied with your care, they like you better, and providing more revenue to your practice. And so in this video, we're going to be covering the top 5 anxiety supplements. So this is very important because as an integrative psychiatrist, I don't just prescribe medications, but I also do supplements as well. And this is really helpful because now I can help my patients get better naturally. I can help them reduce the doses of their medications because I don't need as many or as much. And I can even treat patients without needing any kind of medications. And patients are looking for a lot of integrative, healthy supplement care. So this way, you are able to satisfy the patient better too, and be able to get more referrals for your practice, get better recognized for your clinical skills, and have your employer recognize you too, and just feel more satisfied and fulfilled. So number 5 for the top 5 anxiety supplements I recommend. So I recommend supplements to a lot of patients in accordance with medication. So number 5 are omega-3s. So this is an overall supplement. Like I'll recommend omega-3s to pretty much anybody. I think that this is the number 1 supplement that I recommend. But if I'm trying to target anxiety specifically, this is near the top, but it's not the number 1. And so omega-3s, basically they have 2 components. They have an EPA and a DHA. And the EPA is decreasing inflammation, and the DHA is structural. And being structural, so it helps make up the brain cells. So it helps make up the brain cell component of the fatty acid layer of it. So omega-3s I will recommend to anybody, to 4,000 milligrams per day with a 2-to-1 EPA to DHA ratio. I'm not like super concerned about that, right? I'm not like, oh, it's like 2.5 or they're 1-to-1. But just the most important thing that I think about overall is just 3,000 to 4,000 milligrams per day for EPA and DHA. This is more of an overall booster. It's not like something that's immediately going to change things. So now, number 4 is ashwagandha. So ashwagandha is what we call an adaptogen. And what it does is it decreases cortisol, stress hormone. And so by decreasing cortisol, the stress hormone, I think of it like ashwagandha it's a stress absorber. So I'll say stress absorber. So a good analogy is like a fiber. So fiber is a poop absorber. And so if you have diarrhea, it'll bring it together. But if you have constipation, it like spreads it out more evenly. So that's the way that I think about ashwagandha as well. And so the thing with both omega-3s and ashwagandha is that these are long-term. So actually both of these are long-term ones. And so what does that mean? This means that you're not going to notice a benefit immediately, but over time, like in 8 weeks, in 12 weeks, you start to notice that overall kind of benefit. So that's why these 2 should be taken daily. Ashwagandha typically goes from like 300 to 1,000 milligrams in a standardized dose. So there's better high quality formulations. For example, Sensoril is one. And so 300 to about 1,000 milligrams that I recommend. You can start lower and then titrate upward. But ashwagandha, very helpful for stress, anxiety, worries. But again, these 2 are both long-term ones. So then number 3 is saffron. So I think of this like a natural SSRI. Saffron helps boost serotonin, and studies have found that it is comparable to SSRIs for anxiety and depression, but for mild anxiety. If somebody is having severe and panic attacks, it might not be that helpful. But if someone has mild normal anxiety, generalized anxiety, social anxiety, I think it's super helpful for that. For example, I had a patient who had a lot of social anxiety, and so we started her on Saffron, And she comes back in 4 weeks and she's like, wow, like I don't really feel anxious in social situations anymore. Like I feel way more calm. And so typically 15 to 30 is a very standard dose for this. So 15 to 30 milligrams. Like that's the dose that I would recommend for Saffron. So very safe. You can take with SSRIs because like I say it's like an SSRI, but it's not fully serotonergic like an SSRI. It's got some other mechanisms too, some of which we're still unsure of, but you can take it with an SSRI, but you just want to be cautious of any kind of serotonin syndrome. So oftentimes I might start Saffron first and to get a benefit, but if not, then I'll add on an SSRI, or the opposite. If I think it's more severe, I'll have an SSRI and then add on a Saffron if I need to. Then number two is L-theanine. And I like L-theanine. This is more for PRN, anxiety. So basically this works immediately. So all of these are long-term ones, but L-theanine is one that you take. It's like glasses. You have it when you need it, and then when you don't need it, you don't use it. So L-theanine is like that. So you take it as needed for anxiety. And so it's used for anxiety, for tics, social anxiety, panic attacks, restlessness. So a lot of benefits that L-theanine has there. But I use this, typically I'll use like 100 milligrams and go up to 500. You can go higher if you need to. The main side effect you're gonna have is sedation or grogginess. But as long as you don't have those, then you can push up L-theanine. And the way that L-theanine works is it increases what's called alpha waves. And alpha waves are the waves that you get before you fall asleep. So it kind of eases and lulls things. It's often paired with caffeine. So for example, my caffeine supplements like tablets have L-theanine in them for this reason, to calm down a lot of the jitters, the anxiety that comes with caffeine. And then number one, the GOAT, is magnesium. Specifically magnesium glycinate or threonate. So these two are really important because these ones are the ones that cross the blood-brain barrier. The other one, the ones that you don't want to use, so don't use citrate or malate, because these may be helpful for general magnesium deficiency and for like stomach issues like constipation, but they're not helpful for brain use and anxiety use. So very important to have one of these formulations, specifically the glycinate. That's my favorite. So this is important because patients will think they're on magnesium. They're like, oh yeah, I take magnesium, but they're taking one of these crappy formulations rather than these two. That's the way that I think about it. So by calming down a lot of the physical body, it can help relax and reduce anxiety. And that's why it pairs well with magnesium or L-theanine, because L-theanine does the mental. So this one I'll write mental. And this one I'll write body. So that's why they stack together so well. And so this one is also taken PRN, or daily. But basically, like, this will give its effect immediately rather than these ones, which give their effect over time. So that's the benefit of magnesium. Like, I used to take it for sleep a lot. And basically I found it was very calming and relaxing for falling asleep. So if a lot of people have anxiety, like trouble relaxing at night, they have anxiety at night, magnesium and L-theanine can be super, super helpful to help with that. And so the dose, typically, for example, pure encapsulations comes in at 120. So, you can go to 120 to 480, and you can even go higher if you want to. Just be mindful of diarrhea. And if the patient has diarrhea, all that tells you is that, okay, you need to just reduce the dose. That's all. Other than that, it tends to be very well tolerated. So I'll give it a lot for agitation, for like autism kids who might be amped up all the time, ADHD kids, especially the hyperactive ones, can be very calming for that. So these are the top 5 supplements I recommend you use with your patients with anxiety. And so if you want to learn more about natural holistic supplements, zinc, L-tyrosine, N-acetylcysteine, St. John's wort, if you want to learn how to use supplements effectively with patients, then I would recommend joining our NP Coaching Academy, where we've had over 160 students so far that I teach them integrative psychiatry, clinical diagnosis, clinical treatment, and how to get the best results for patients. So if that interests you, consider joining our NP Coaching Academy, and I will see you in the next video.